Good morning, everyone. First of all, let me wish you a very happy new year. I pray that this year be safe and very productive and prosperous and peaceful for all of you. So strive towards. We are only on the second day of the new year, so I wish you and I am hopeful that you will be making continuous efforts to strive towards making this year better and better. And hopefully, with the run of vaccines and approval and all these things, we will see some control over the coronavirus scare also. And let us be hopeful that things will be positive and in control and much better compared to the next year, last year, I mean. So, today, on a positive note, when we are talking about all things positive, yesterday I think I circulated two messages through Janvi and Deepshik in your batch. These two messages, if you are confused about what they are, so because your exams are nearing and it has now been announced by the university that your final exams will be somewhere in the month of April. So, if they're assuming that there won't be any changes to that, we will accordingly plan your pre-final exams. We will plan your internal exams, and just to keep track of what has happened over the past 1 year, whether you have read the topics or not, whether you have understood the topics or not. So you start reading and you start giving it your final read. So we have planned that there are certain topics which have been updated and there have been a lot of changes in those topics. So we will try to keep some interactive seminars from students. Okay, so these seminars are not from faculty. These seminars will be from students, and we will try to do it through Google online platform. So I will circulate the details over the next week, and maybe I'll give you a week's time to prepare, and then together two or three students, just such as let's take the topic of dengue, which is ever evolving, and so many new things keep on coming up. Okay, the topic of coronavirus, let us say, it is bound to be asked in examination whenever you appear for the examination. So what have been the changes, what have been the developments over 1 year, and how vaccines were developed, so which are the vaccines which have been approved for use. So all these things we will try to cover in seminars quickly, so that you also participate in the reading. We can also give some inputs, and in turn we can understand actually how much you have understood. Okay, so the focus of these seminars is not pulling your legs or not to criticize you, but it is to help you understand better, to formulate an answer. And these will not be very hectic on one student. We have planned that three or four students together will take up small portions of the seminar, and it will be interactive, so that all the faculty can sit together and participate. Hopefully we will try to get some faculty from other places also, like externals who have been your previous externals, and we are in contact with them. So we will try to get them join online and give us some let's say inputs over how to improve your answers on these topics, or how to improve your understanding of these topics. Second thing was slip tests. So we have also planned that we have already started revision for so many topics. Already we have finished the revision for so many topics. So we will have small slip tests of 10 marks or 20 marks, where you will be given some short notes and you can turn them in to me and other faculty. We will evaluate and we will give you marks. We will consider these marks cumulatively in a weighted format for your second internals. I don't think you will have your second internals now, but whatever topics we are revising now, we will have small slip tests and we will cumulatively give weighted marks towards the second internals. So that will also help you to read small portions and then reproduce them in the form of slip tests and help you read better and retain better whatever is being asked. Okay, so in the series of revision we talk about mental health today. Mental health, was very important from very long time, but due to pandemic and all these things, it has assumed greater importance because so many adverse mental health event have taken place over this pandemic period, not only in our country but across the world. So we will quickly revise today what is mental health and how it affects the population and what can be done to promote mental health amongst the population. We have already done it as a lecture, so we will quickly rush through what are the salient points in mental health and mental health program. So by definition, it is the state of well being in which every individual realizes his or her own potential. He can cope with the normal stresses of life, he can work productively and fruitfully, and is able to make a contribution to his or her community. So, that is a definition which revolves around the definition of health, which was given by World Health Organization in 1978 in general. But this is a state of well-being of the mind rather than of the body. So it is not just the absence of mental disorders. So there are so many mental disorders which you must have read in psychiatry. So not having one of them does not mean that you are mentally healthy. You have to fit into the scope of each of these keywords to cope with normal stresses of life, realize your own potential, work productively, make a contribution to the community. So, all these key terms in the definition should be satisfied in order to call a person mentally healthy. So, if you look at the history of mental health, it was said that mentally ill were considered to be possessed by the devils and they were locked up and alienated. They were given adverse treatment. In the older times, shock therapy was very common, and later on, tranquilizers came in. So, to soothe down aggressive patients, shock was given and they landed in coma. Even insulin coma therapy finds its mention in some of the books in history of medicine, which was used for the treatment of mental health illnesses, particularly psychotic illnesses, I would say. And tranquilizers were also given. So these people were isolated from the society, alienated, and then treated in isolation. They were not considered to be a part of the normal society. But now things have changed. They are being gradually accepted more and more by the society, and supportive role of the family and community has emerged as the mainstay of therapy for mental health problems. So historically, you see there is a major shift from treating in isolation, sending the people in asylum, to accepting them in the community, treating them at home, and caring for them. Okay, so in between there was a time where they were admitted and treated in a general hospital also. But now for most of the things, if it is controllable at home, then home surrounding or treatment at home or domiciliary treatment is the preferred mode of treatment. And that is why there is a lot of onus on the family members to identify mental health problems early. Of late, I am seeing a commercial, I won't call it a commercial, but a promotional message on television in between all the movie breaks and everything, when they are saying that, I'm sure you must have seen it too if you are a watcher of TV. Even I think on Netflix on one or two occasions it came. So even if you binge watch or watch Netflix, whatever. So this says that there are so many symptoms that it does not happen all of a sudden. I'm sure there is a man a crying joker and he's trying to push away everything, and then the final caption emerges that it does not happen all of a sudden, it is underlying. So it is the role of the community, it is the role of the people who surround this individual to identify and then refer this person for appropriate support and treatment. So let us look what is the problem statement for mental health problems. They are universal in nature. There are neuropsychiatric conditions which have a prevalence of about 10% for adults, and amongst the neuropsychiatric disorders or conditions, we have unipolar depressive disorders, we have alcohol use disorders, we have schizophrenia, we have bipolar affective disorders, Alzheimer's, and other dementias. So together they account for a prevalence of about 10% in adults in and at any point of time. But when we say 10%, you must realize that this is only the tip of the iceberg. Many of the people are lying, many of the much of the prevalence is submerged, okay, which you cannot see because of gross underreporting of mental disorders. Once you visit a psychiatrist, it's considered like a tag that you have visit. You will be tagged as a maniac. Not you, I mean the patients are scared that they are tagged as maniacs for life, and nobody likes to be with them, nobody likes to make friends with them, they might lose their jobs and so many other things. So people like to hide, people like to not consult psychiatrists for these conditions, and they run here and there for local or let's say whatever local treatments are available, or whatever people word of mouth treatments, that you do this, you do that, and you will be better, something like that. So which is not a definitive treatment, and it might harm actually the condition even more, because treatment is being delayed and deferred to a later point of time when the disease becomes more severe. So neuropsychiatric conditions 10%. Amongst these conditions also, there you see there is a gender discrimination, and it is said that women are twice as likely to develop mental disorders, especially amongst mental disorders. Anxiety and depression are two conditions which are more prevalent, twice as prevalent in women compared to men. So we have several researches. You must remember, when we talk about anxiety and depression, yes, they are more common in women, but when you compare the severity, so you see that women are more likely to be in the mild grade of anxiety and mild depression, whereas men who develop anxiety or depression are usually in the more severe grade. So that is the gradient in grading of depression among men and women. But mild depression is yes, twice as likely amongst women. So other conditions which World Health Organization has published in its manual are that they are women are also more likely to experience traumatic conditions like sexual assault, abuse, or and early life experiences, adverse experiences in early life or in the middle life, due to which they develop post-traumatic stress disorder. So yes, this is also very common because there are several biases in the community or several adverse treatments for women in the community, which leads to post-traumatic stress disorder. If you talk about the Indian population, then there is one entity called postpartum depression, and it has been reported in various papers that among Indian women, the prevalence of postpartum depression, that is depression immediately following the birth of a baby, is almost to the tune of 20%, which is quite high. So every 20 mothers among the 100 women who delivered normally will be suffering from postpartum depression of a severe degree, which can have adverse outcomes for the baby and for the mother herself. In very severe cases, it has been seen that the mother has neglected the baby totally, or even has killed the baby and then killed herself in guilt. And these are some of the very severe consequences of severe postpartum depression. So they don't want to live anymore, they don't want the baby, and so many different things happen psychologically. So this is also one very common condition which should be identified, which should be that's why there are several strategies to promote bonding between the baby and the mother, and so that normal growth and development of mother and motherhood, okay, both keep on happening. Okay, so if we look at our younger population, this was in general what is happening globally, what is happening in terms of diseases. But what are the diseases of the younger population? We have a huge young workforce, one which is one of the greatest young workforces in the world. So if we look at our younger people, then what are the mental health conditions? So it was seen that economic loss in India, how big is the problem if you look at it? So economic loss in India due to mental health condition was about $1.3 trillion between 2012 and it is estimated till 2030 it will be about $1.3 trillion dollars. So which is a huge loss. That means so many people will land in depression, or they will suffer from other neuropsychiatric conditions, and they will not let's say come for work. And already we have seen this condition is going to be much larger than 1.3 trillion, because when these estimates were projected in 2012, COVID situation was not there, and now this I'm sure would have doubled because of job losses and because of financial insecurity and so many other things which happened during the pandemic, which added a huge burden of mental health problems to the younger workforce of the country. So India accounts for about 40% of the suicides globally, and suicide, you will see, has surpassed maternal mortality as the leading cause of death among women and teenager girls aged 15 to 19. So such is the high prevalence of suicides in India. Almost 50%, 40% is almost close to 50%. So half of the women and teenager girls in India, let us say, are prone to suicides, and they have attempted suicide sometime in their life, or they have the tendency to commit suicides. Not all of them would have committed suicides, but attempt to kill oneself is also counted as an attempt to suicide. So all these numbers are included in this 40%, which is a very huge number, you will agree. So according to the National Mental Health Survey of 2015-16, 9.8 million teenagers in the group of 13 to 17 years, they suffered depression and other mental health problems. Lancet also, there was an article published that suicide deaths ranked first amongst all causes of death in women aged 15 to 29 years in 26 of the 31 states in the country. Okay, and similarly in other states also. So why these suicides happen? So the cause has been attributed to increased expectations, pressure from all fronts, mostly among working women, inability to question people about their wrongful deeds or wrong behavior. So they are usually, women are usually considered more timid and heavy workers without questioning, okay, why a certain thing is being asked for from them. Then gender stereotypes are there. There is no facility for dialogue or discussion surrounding health. So women's health has been neglected for very long in the Indian society, and they are always secondary. They have always been given a secondary status compared to men, and the absence of qualified and approachable therapists or counselors. These are some of the reasons which have been cited for large number of suicides amongst women in India. So, if you look at the numbers of doctors, out of 936,000 doctors in India, there are roughly 4,500 psychiatrists to serve a population of roughly 1.3 billion in the country, which is a very, very low number. So, country needs more psychiatrists, country needs more awareness about mental health problems so that they can be identified and treated early. Okay, so more statistics is there. I think you can look it up in the books. Your park will show you a lot of statistics. Next, we move on to characteristics. Again, in the first chapter, some characteristics are described. In the mental health chapter, also characteristics are described. So these are that a mentally healthy person feels comfortable about himself and has self-respect. He feels right towards others. He is able to feel a part of the group and like and trust others. And third, he is able to meet the demands of life, able to think for himself, take his own decisions, sets reasonable goals, and is not bowled over by his own emotions of fear, anger, love, or guilt. Okay, now this third point is very important because there are so many conditions or comorbidities surrounding mental health, poor mental health, especially anxiety and depression. And I would say the most remarkable ones amongst them are like diabetes, hypertension, obesity, okay, risk factors like obesity, alcoholism, cigarette smoking. So these are some of the things which people try to get rid of, and they set very unreasonable goals like I want to become like a supermodel, and then they are not able to do it, reduce so much weight, and ultimately they give up and they land into depression, which leads to further binge eating and greater epidemic of obesity. So particularly I'm talking about obesity because this has assumed so much importance that now the epidemic of obesity over the globe, because of depression and other reasons, and obesity as such, okay, it is termed globesity, 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 global obesity you can call it. So this has taken epidemic proportions which is grossly let's say not seen by the health authorities, by the World Health Organization, or these things. Of course, they are recognized now, and actions are being taken at all levels to promote healthy weight gains by people across the world. But only awareness and all these things are not enough. So, active interventions in the form of lifestyle changes, education of the population to adopt to those lifestyle changes has to be done so that this epidemic can be recognized and curtailed. But you know how much people are aware about obesity, and how much effort they are putting to control it or get rid of it. So, uh, some warning signs of poor mental health are also listed in your book. Important ones are difficulty in sleeping, lack of self esteem, mood swings, taking drugs or alcohol, losing touch with reality, become isolated, harming yourself or harming others, becoming angry. So, some of these things are early warning signs of poor mental health. So, parents are advised to watch out for their children if they have frequent mood swings, or if they have difficulty in sleeping, if they are not hungry, if they are not playful. So they should report with the child to the health facility. And amongst teenagers and adolescents also, parents are expected to be on a very close watch on the behavior of the teenagers. Adults also, spouses are advised, or other family members are advised to keep a close watch on each other for these warning signals of mental health. So, mental illness is a behavior which is characterized by disturbance in thinking, mood, or behavior which is out of keeping with the cultural belief and norm. So, it is just the opposite of the definition of good mental health. So, in most cases, symptoms are associated with distress and interference with personal functions. And it is worthwhile to note that most of these conditions can be successfully treated with medical help. So, symptoms are mostly physical, emotional, they may be cognitive, okay, affecting thinking, They may be behavioral, they may be perceptual, such as hearing or seeing things which others cannot see. Like we say that the person is in delirium or he is hallucinating, he is seeing something which other people cannot see. So that is perceptual signs. Okay, perceives, patient perceives and others cannot perceive those. So early signs, they can vary from disorder to disorder. It is not that every person will have the stereotype signs, but yes, changes in behavior compared to the healthy period can definitely be appreciated, and all such changes should be which are affecting the health of the individual adversely. Okay, it may be physical health, it may be social health, it may be psychological health. So all such things should be brought to the notice of the health provider. So if we look into the types of mental illnesses, there are broadly two types. One is psychotic illness, the next is non-psychotic illness. In psychotic illness, it is a condition which affects the mind and results in loss of contact with the reality. Okay, so all your delusional diseases and all these things where the patient perceives that something is happening which others cannot see, so he loses contact with the reality. So when someone experiences psychosis, their thoughts become disordered and they have difficulty in knowing what is real and what is not. Okay, so they develop delusions, hallucination, illusion, etc. Types of psychosis: there can be brief reactive psychosis which occurs as suddenly in response to severe stress such as bereavement or severe trauma. This usually lasts for less than a month. Now you might have seen that family members who have suffered the loss of a close one, okay, then they tend to believe that they are around, they tend to see those people moving around them, and they very often they think of them next to them, okay, being close to them. So that happens when suddenly unexpected death of somebody happens in the family and they are closely attached to those people. So this lasts for about less than a month. Then there can be drug induced psychosis which is brought about by the use of drugs such as cannabis, LSD, magic mushrooms. Their effects also usually last for a few months. And finally, there can be organic psychosis, which appears when someone suffers from a head injury or a physical illness which disrupts the brain functioning, such as the Alzheimer's disease. Okay, so these are the three kinds of this one. Then we have schizophrenia, which is a psychotic illness which changes behavior for at least 6 months. So now we are moving from acute short term to long term diseases. So schizophrenia is one. Schizophreniform is a psychotic illness that lasts for less than 6 months. So that is shorter in duration compared to established schizophrenia. And then there is schizoaffective disorder. It is also a psychotic disorder which is not typical of a mood disorder or schizophrenia. So it is somewhere between schizophreniform and schizophrenia established. Next, we have bipolar disorder, which is also called manic depression. This is characterized by extreme mood swings between depressions and mania. Okay, so sometimes the patient is very low. He may lock himself inside a room and weep for days, and sometimes he is extremely high or extremely elated. So they will suddenly start laughing, going out with friends, and watching movies and celebrating. Okay, and then suddenly this is followed by sudden depression. So these are extreme mood swings. You tend to see them in many people. Few days in a month they are extremely happy, and other days they are not traceable at all. So this is bipolar disorder. Psychotic depression is a depression with psychotic symptoms without mania. Okay, so they are usually depressed without reasons. All the time they are depressed, they are weeping, they have suicidal tendencies, so they do not show any signs of mania at any point of time. So most people who experience a psychotic illness are able to live full and independent lives with effective medication and support. So that is important to remember. Next category is non-psychotic illness. So non-psychotic illness occurs every day. with the feelings of depression, sadness, tension, anxiety, and fear becoming so overwhelming that people have difficulty in coping with day to day activities such as work, recreation, or even harming their relationship. Okay, so if somebody continuously says that I'm feeling sad, I'm feeling sad, so there is a lot of domestic tension and chaos. He neglects household work, he neglects relationships with the spouse and the child because of such sadness, and this can also be controlled by effective counseling and some drugs. So these illnesses, non-psychotic, they include agoraphobia, panic disorder, social disorders, obsessive compulsive disorder, okay, which is very common in many people. Okay, some people, mostly they have obsession with cleanliness, and it can become a menace for the other family members to follow it. Okay, post traumatic stress disorder is one of them, which is related to adverse at early life events. Okay, so these are some of the things. Eating disorders are there, depressions are there. So most non-psychotic illnesses, they can be assisted by treatment like health education, counseling, and in some cases cognitive behavioral therapy, meditation. They have also yielded very positive results for non-psychotic illnesses. Now, the causes of mental illness, if you see, there can be organic conditions, there can be hereditary conditions, or there can be social pathological causes. All these causes are listed in your books, so you may have a read and you will find out. Okay, so among organic conditions, we have cerebral arteriosclerosis, we can have neoplasms, we can have neurological disorders, chronic diseases. In hereditary, there is role of genes. In psychosocial factors, there are worries, anxieties, emotional stress, tension, frustration, unhappy marriages, broken homes, poverty, economic insecurity, COVID-19. So many different things are there among psychosocial factors. Okay, then there are environmental factors like toxic substances, psychotropic drugs. There might be nutritional factors such as deficiency of thiamine or pyridoxine in diet. There can be deficiency of iodine. There can be some infectious diseases or agents which can lead to depression. There and then can be traumatic factors, and radiation also is known to play a role in causation of depression. So, several papers have been published about all these things, and most of them, they have pointed out that there are individual attributes mostly which determine how the mental health will be. There are social, cultural, economic, political, environmental factors such as poverty, low education, okay, many national policies, working conditions, living standards, which also determine how the mental health of a individual is likely to turn out. And some papers on genetic factors have also identified certain genes in the causation of poor mental health. Now, these are some of the crucial points. Prenatal period, okay, because pregnancy is very stressful for some women. They need help for their emotional needs, their physical needs. So, women in the prenatal period are one of the target groups. Okay, pediatric age group, first 5 years of the child, they should be warm, they should be supported by family, they should be cared for. If the adverse of that happens, then such children turn out grow to become individuals with poor mental health. Okay, so everything that happens at home and school, they affect the mental health of the child. So this is a target age group. Adolescents or teens is also a target age group because their body is changing, their mind is changing, there is increasing need for independence. Okay, so they need proper counseling and emotional support during this phase. If they are not given that, if they are not given their required freedom, but with let's say supervision and monitoring, but they need to be free. So it is a very delicate balance. So if they are not given that, then again some problems may come up with difficult adolescents. Okay, and finally, in old age, we should not neglect that most of the mental health problems occur in the old age. Rates of suicides are one of the highest in the old age because they are fed up of their chronic conditions. There are several organic conditions of the brain which need to be recognized and treated, and love and support and care is to be provided for the old age people. So these are some of the target age groups which require very close, let's say, watch for development of symptoms of poor mental health. Preventive aspects, if you see, they revolve around early intervention, prevention, and treatment and recovery. Okay, so there are treatment support groups, there is healthcare, there are family members. So this is the circle of treatment. There is an outer circle, there is an inner circle. Outer circle, inner circle for recovery. Okay, it is based on understanding, wellness, trust, respect, competency, hope, spirituality. So all these things are paid focus on. And outside, there is mostly supportive role through peer support, family, friends, housing, education. Okay, protection by the governments, community mobility, income support. So this is mostly the supportive role provided to a individual who has been targeted for recovery from the mental health condition. Then there is mental health promotion. What is this? This is promotion and protection, which involves creating an environment that promotes healthy living and encourages people to adopt a healthy lifestyle. And it is one of the points in sustainable development goals also. So that is why it calls for early identification and promotion of mental health in all walks of life. So and this also involves a multi-sectoral engagement, and that is why this calls for a life course approach. So uh, last, you can stop with the mental health World Mental Health Day. So recognizing the importance of mental health conditions and growing need for mental health, the World Health Organization co-sponsored World Mental Health Day along with World Federation for Mental Health in 1992, when the first day was proclaimed. Okay, and through on this day, it is observed every year on 10th of October. World Health Organization, it requests the member states to promote mental health and healthy behavior uh, uh, in all possible forms. So for 2017, it was very important. The World Health Day theme itself, not the Mental Health Day, but the World Health Day theme was depression, let's talk, and several forms of depression in various walks of life were highlighted. And there was if you look at the toolkit or the manual of World Health Day 2017, they have beautifully given what are the various phases of life or various target groups where mental health can be a problem, and how to identify them early and how to treat them. So, lastly, we talk about you can talk about the mental health program, which was launched in 1982 in India. Uh, Comprehensive mental health program includes all community facilities pertinent in any way to prevention, treatment, and rehabilitation. Okay, so some of the essential elements in this program were inpatient services, outpatient services, partial hospitalization, emergency services, and diagnostic services. Again, please read up the details of all these things in your book. And in addition to all these hospital or institution based services, there is also mention of pre-care and after-care services, including foster home placement and home visiting, education services, training, research, evaluation. So, what is the role of all these things in promotion of mental health? Then there is a special mention of mental health promotion among the young population. It was even introduced in various schools in North India, where the adverse effects of poor mental health in the form of suicides or attempt to suicides in school children is high in Delhi. So they introduced a happiness curriculum. Okay, so they had certain events in their curriculum which would be relaxing for the children. Okay, they will help to take a break, and most of the curriculums that now the schools follow are not very grade based, not very marks based. Okay, so they are not very competitive now. They are mostly grade based. So you are in the top 20%, top 40%, something like that, and it promotes. If you don't have marks, you don't know. Nobody bothers about who was the topper and who was not. So it makes the children happy that they got an A grade and they are among the top 20%. They wouldn't know if they are the topper or not. So and there are several other activities like sports, like creative arts, writing, and whatever makes them happy. So there is a whole new curriculum which has been introduced as the happiness curriculum. In between, there was uh, the option for skipping the exams and tests. Okay, so then such a curriculum was also promoted, and under this curriculum, other activities and periodic assessment was promoted. So this was also called happiness index. So several of these interventions have been tested in various schools. Some are following it, some are not following it. So children need to be exposed to such kind of curriculums to decide curricula to decide which works best for them. So this is a value added program. Apart from that, where we stand legally is talking about the Mental Health Act. If violations are made to those acts, or if those acts are not according to this act, there are special provisions for awareness at the workplace, and if those are not made, then governments have the power to take action against the organizations. So that is all in mental health program. Please read it up. In the next week, I will circulate some messages through your friends on your WhatsApp, and we can prepare for the seminars, and also for the slip tests, which will start from next week on. Thank you and have a very good day. Again, I wish you all a very happy new year, a positive new year, so that you are able to make good use of the year ahead. And I wish that all of you study, all of you pass, and then all of you go to your next semester. So thank you very much, and enjoy your day, enjoy your weekend.